Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, let's talk a little bit about education funding plus gubernatorial transition. It's underway, but first, how about a healthcare update? What's in, what's out, what changes have taken place in healthcare? Let's look forward to 2015. We'll do all of that and more after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Welcome back to the show. Well, let's start with a little healthcare update. As often is the case, we have our friends from the Hospital and Healthsystem Association. Joining me is Dr. Michael Consuelos. He's the Senior VP of Clinical Integration with HAP, and Scott Bishop, he's the Senior VP Legislative Advocacy with HAP. We're going to get rid of all these titles. It's Doctor and Scott. How's that? And we'll get into it. That's what people really care about. All right, Scott, I'm going to start with you. I mean, this was a fascinating year when we look back on healthcare. The implementation of the Affordable Care Act, bumpy up, down, folks signing up for it. We're in the second year of the sign up. Hospitals, we have closures of some, tough time for some rural hospitals. Big changes taking place. What would you say were what would you highlight? We'll get to the future. What happened over the course of the 2014 that you would cite?
Well, it's been close of the state legislative session. A lot of key things happened, and as you say, it always starts and ends with funding. So it was a good year for hospitals. The legislature, the governor invested, I think, where they needed to in hospitals, and the lines that are important in making sure that we can provide the quality care that we need to. But it's a changing time. We continue to see consolidation. We continue to see hospitals trying to figure out how they provide that level of care. Once they traditionally used to do, they can't do it anymore, and so it's been a series of changes, for sure.
Now, Doctor, one of the things that we hear this term clinical integration. I always ask this question: why should our viewers care about it?
Well, that's a great question, Terry. So I think from the patient perspective, that's what they want. They want seamless care for their health problems and prevention of health issues. And traditionally, from the acute care hospital perspective, it's been episodes of care. So you get sick, you get treated, there's a diagnosis that's made, you get treated, you get sent home, and then something else happens at a later date.
You come back, you go through the same
Exactly.
cycle.
Right, exactly.
So what now is going on?
Well, what's going on now is really a drive towards integrating all episodes of care more seamlessly and increasing communication between providers, but also looking outside the four walls of hospitals. And hospitals have actually traditionally done some work on the outpatient area, but now we see a trend of greater and greater ambulatory intervention and preventive health intervention. So now patients are seeing primary care physicians integrating with hospitals, integrating with rehab hospitals and long-term care facilities. So the whole continuum
So it's sort of seamless. You're not sent home and say, okay, you're on your own.
Correct.
Now you've got all sorts of differing folks involved in providing health care. There's a lot more coordination, I noticed. Is that true?
That is true. And I think technology is really helping with that. And I also think that the payment reform is really driving us towards that end.
I do have one concern. I want to come back. It's not nothing you did. I want to point that out. I want to come back to this, and I think it's important. I'll come back to this, but I want to go. Was there anything legislatively that happened that you would cite? I mean, I didn't get the sense this was sort of one of those years where you could say, okay, there was a landmark piece of legislation passed. No?
Well, it's been a landmark session at the state level. A couple of big things: medical liability reform, and also the biggest thing is the way the Commonwealth license hospitals. It's not something that patients see day to day when they walk in and they say, oh, there's licensure reform. But it's one of those things for 30 years, hospitals were licensed a certain way, a lot of bureaucracy and excessive costs, streamlined, and that's gonna help hospitals on these other kinds of reforms that they need to do. They don't have to worry so much about what was done. So I think that was important because
there are problems with hospital. I mean, there's closures in rural hospitals. I mean, we're heading into a very interesting period, aren't we?
We are. I mean, because to what Dr. Consuelos talked about, it's payment reform being able for hospitals to keep in that same mode that they can't do it. And so they either have to become part of a larger system.
We often hear a lot about urban hospitals, but it's the rural. I mean, we have a big state, rural state, lots of small hospitals, and that means more tenuous, getting to a physician, then that's the question I want to get to. I'm going to ask it and we'll run to a break and then we'll come back. More and more, here's what I hear. You call for an appointment, 2 months. The shortage of physicians. I mean, this is becoming, and I'll let you think about it. I want to run to a break, but, well, I can see you in 2 months. Now, if you have an emergency, you go obviously to one of the hospitals. I think the shortage of physicians is something that has not been talked about or addressed enough, and it's looming as a huge crisis, if it's not a crisis already. We'll come back and we'll talk about that and more after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. Well, we're doing a little healthcare review with Dr. Michael Consuelos and Scott Bishop. Both are with Hospital and Healthsystem Association. Doctor, before we went to a break, I was bringing up this point, and I think it's far more serious than, maybe I'm on Mars. And
No, Terry, I think that's a common perception, and it's a common reality. And in fact, I'm on the committee for the State Commission looking at physician shortages. And so if you look at Pennsylvania compared to other states, we're about average for physician numbers, but there's a maldistribution of where our physicians are. So as you mentioned earlier about rural areas, there's clearly not enough, especially specialists in those areas, and there's a high density of physicians in more urban areas, but even there's a stretch. I think you see a couple things happening. One of them is the aging of the physician sort of workforce.
Yeah.
And in that, I think a really good thing is happening is that women are entering the workforce on the medical side. And both men and women are using really a part-time status now. So lifestyle is
lifestyle is a factor.
Correct. So actually the numbers may be okay, but actual full-time equivalents in the workplace aren't what they possibly could be.
Well, go ahead. You want to add something to that?
Yeah, I do. I think there's two things the hospitals are doing to try to get to that too. The first is trying to engage in telemedicine more, partnerships between some of the urban larger hospitals and the rural hospitals. And then two, more and more hospitals are moving to a system where it's not just you go to the hospital and you're incredibly sick and then you're an inpatient, traditional, but they're trying to start this process so from start to finish they're managing the health of patients. So you don't necessarily have to, you may still have to wait a little bit, but it's a full team and the patient is the center of that care, and I think that's important.
So a lot of it can be done without necessarily seeing a specialist as in a preparatory sense, and in a sense to not so much preparatory, maybe that's the wrong word, but sort of a healthy lifestyle, doing more things to prevent you from getting to the point where you have to go see the doctor there, right?
It is, and it's an incredible investment because it's the model is you get to the hospital and you're given inpatient care. That's the current model. But then to shift that so you're actually doing that preventative, healthy lifestyle, it's a major shift, but hospitals are doing it.
All right, before I let you go, I want to ask both of you the same question. Now, we're almost done with 2014. We're moving ahead. Huge challenges ahead. What's the biggest challenge you think the hospitals are going to face?
The federal,
I know, tough question.
Yeah, federal level, it's stable funding. Unfortunately, it goes to that.
You're talking about programs like Medicare,
Medicaid. Potential cuts in payments for hospitals, physicians at the federal level. It's always a challenge, and some of that falls into the state level as well. But it's keeping government focused on giving hospitals regulatory relief and allowing us to do the kinds of things that we can shift to that model where we're giving the holistic care for patients.
Right.
And I would say the same. Point of view. Yeah, I would say the same thing. And I think in that driving force, the movement from acute episodic care to population health. The structures, the research in medicine has been all about make a diagnosis and make a cure, and not about prevention. So in the new value-based payment reform model, making that transition and the continued pressures on the costs going up and the payments going down.
All right, before, we're out of time for this segment, but I want you to come back, and we didn't get the chance to get into this whole business of this complexity of Medicaid expansion. You know, Governor Corbett has, Healthy PA. Folks have been signing up now for several weeks. 600,000 people perhaps are eligible. Governor-elect Wolf has said, no, I'm going to go to what I call traditional Medicaid. Complicated. You'll come back, and we got to get into that because I think but both of you are shaking your head. Yeah. However it shakes out, it's hugely important.
We want people to be covered.
Yeah, we want people to be covered. I polled on those. Both of them are popular. It's not a question of, for the most folks, which one you choose. It's a question of having the health care. Right. That's not even an issue. No one disagrees about that, I think. Yeah. But that was a great update, and we'll see you in the new year.
Great.
All right, let's take a look. Fair education funding, how much money should be put into our schools, and plus a little bit of governmental transition with the new governor-elect, Tom Corbett. Dave Patti will join us, and we'll chat about that and more.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Healthsystem Association of Pennsylvania, working towards a healthy Pennsylvania, and by the Pennsylvania Coal Alliance, representing companies involved in America's most affordable, reliable energy source. To learn more, visit pacoalalliance.com.
Well, welcome back. Dave Patti, he's president and CEO of the Pennsylvania Business Council, joins me. Earlier, we have the problem with the running in the governor's races. We had Tom Wolf and Tom Corbett, right, Dave Patti? And I may have referred to Tom Corbett as the incoming governor. I think it's the other way around. He's outgoing and Tom Wolf is coming in. If I misspoke, who knows? At any rate, Dave Patti, let's first of all talk about education funding. As you know, you issued during the campaign for governor, the folks, concerned about not just about the amount of money that goes into education, but how it's distributed.
Right.
And that's where something called the Fair Funding Commission, do I got the name of that right?
Campaign for Fair Education Funding is a coalition, and at the same time there's a legislative commission, so it gets a little confusing, that's out holding hearings. So there are two parallel efforts, often talking to one another. Both lawmakers taking testimony from around the state, as well as a lot of diverse groups, ourselves included, but education groups, child advocacy groups, faith-based groups working together.
And what are you trying to accomplish?
Well, you're right to say there are multiple components. So one of the issues is how much money do we spend totally on basic education funding? That's somewhere over $5 billion that comes from the state now. Now, totally we spend about $26 billion on K through 12 or pre-K through 12 education in the state. The largest share actually comes from school districts themselves, from local taxpayers.
Property taxes.
Mostly property, earned income tax as well. Then secondly, of course, you get the state component and a little bit of money from the feds. So there is the question of how much do we spend total, and is it enough to get the outcomes we want? Second part of that is how do you distribute to 500 school districts? A third part is those outcomes. Are we getting value for the money? That's where the business community comes from. Can the kids read, write, do the math? Are they prepared for post-secondary education, prepared for a job afterwards? And there's really also a fourth element to just the data that we base all this on, the transparency of that data, the availability. Do we all understand what it is that we're looking for?
So the public can be aware of exactly what's transpiring, where the money's going, how it's being spent, whether it's being effectively used. Is that the point?
And the population that it's serving. We have school districts that, as we know from the political side, we have areas of the state that lost population or didn't grow as fast. Well, that's also true of the school populations.
Right.
So do you keep sending money to a school district that's population is going down? You have school districts that the parents, in a search for better education, are going to charter schools and private schools and parochial schools looking for other alternatives so that the public school population is going down.
So is there, as Meryl Streep, the actress, might say, it's complicated?
It's complicated. It's very complicated.
Yeah.
But it's also very important.
Well, no kidding. I mean, I think there's no one who wouldn't agree that the future of this state, the future of our nation, is involved in the education of our youth. One of the parts of this debate that affects the Fair Funding Commission is the way we appropriate it, in the sense of, does everybody get a percentage of what they got before, or should a formula be used, and we've had one at least twice, you correct me if I'm wrong, and then done away with in recent years, taking into account all sorts of things, like you just talked, some of which you talked about.
We're one of the few states that really doesn't have a formula per se, to distribute the money. As you said, we did in the 70s and the 80s, and then a slightly different version, I guess, in the 90s. But for more or less the last few decades, we've really been kind of flying by the seat of our pants. Every year it's a legislative process, which means a political process. Yeah. And there are factors that are weighted, but usually that's also talking about the new money, because in spite of what people may hear and read, every year pretty much we're putting in more money.
Right.
It's a question of as much as some people would like to see.
And where it goes.
But we've also always had this kind of rule for the last, I don't know how many years, of saying hold harmless. In other words, you're not going to get less than you got the year before. And if your population is going down, one asks the question, do you still need the same money? Now, it's also true that some of those school districts have other challenges that are new within that time period. Right. And so that's why we have to look at factors. Population is certainly one of them, the number of children that you're educating. But you also have to look at children living in poverty, not having enough nutrition, not having access to health care, special needs. Yeah. We do special education funding itself separately, but there's still kids living in trauma who are in households that have had all kinds of problems. I mean, we know that goes to affect learning. Right. Race, has an impact on learning. Sure. Sometimes it's lower expectations. Sometimes it's not getting the right treatment by the school districts themselves. But we know that there's a correlation between performance and all of these factors. What we want to know is now what does it cost to fix those factors? Right. All right, we're going to run to a break. When we come back, I want to ask Dave Patti what he thinks. We've got a gubernatorial transition. We have a new administration coming in, a more conservative, Republican-controlled legislature. I think that's a fair statement. We'll talk about incoming Governor Wolf's transition and get the perspective from the business community, and we'll do that in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Business Council and by the Pennsylvania Business Council Education Foundation.
Welcome back. We're chatting with Dave Patti. We did education funding. Now we're going to talk about the big subject that is on everybody's mind. We've got a gubernatorial transition underway with Governor-elect Wolf. Governor Corbett will leave office on January 20. A new administration, coming in. Obviously, David, I think you would agree, a pretty ambitious agenda, a legislature, that's not in the same page on many of these, but the attitude seems to be a little different.
No, I think both sides have been doing a good job. I think Governor-elect Wolf and I think the new legislative leaders have all been saying all the right things. Yeah. And saying, look, we're going to sit down, we're going to talk, we're going to work. We're going to sit at the table. There will be things that we don't agree on, but we'll discuss them. So that's all very positive.
Yeah. But it's the substance that ultimately matters, and we can engage in a lot of speculation where it goes, who knows. But it's obvious that a couple of the things that the governor-elect wants to do, seem a little more difficult than others. The most difficult, I think, would be any kind of an progressive income tax change. Would you agree? Well,
it is, but the transition itself is a learning experience, and it's a learning experience for everybody. Even sometimes the people who are already working in government learn things as they have to write them all down and say, well, here's what we've been working on, and deliver them for the new team. Right. I think John Fry, former president of Drexel, former president of F&M, is a brilliant choice to lead that effort. So the governor-elect and his people, the ones that will form the inner circle, I think very much we'll learn from that process what's doable, what's not doable. One of the things they'll look at is, well, you know, here and last week we were talking about the mid-year budget performance and how things were going. And of course, Mr. Zogby had come out,
dueling
and then
budget
Wolf and
press
Shapiro came out,
conferences,
and sure, you know, so you know, now a week of thinking about that, going through the numbers, people are going to look over those things and start to say, okay, what kind of revenues do we want to try and raise? Where can we have cuts? What would work to raise the revenues? And then they can, within that context, decide whether or not progressive
But the one thing that strikes
works.
me as doable, and you may not agree with it, which is okay, we don't have to always agree, is a shale tax. Now, maybe not 5%, maybe 3-4%, with the understanding that even some Republicans have talked about the need to raise revenue. Now, the downside of that could be, look what's happening to gasoline prices, right? Affecting natural gas. Go ahead.
Correct. Well, you're right. No, the wellhead price of gas is very, very low right now. So royalties to the owners are low. The desire to drill more wells is low. Right now, what we really have to do is get that gas to the marketplace and sell it so we get revenue. And everybody gets revenue that way. Now, Governor Wolf, or Governor-elect Wolf, has been saying that he laments the fact that we are low in job creation. He wants to set that as a real goal. And there's a benchmark that the Pennsylvania Business Council agrees with him on. You know, let's look at what do we do, what are the policies that help us grow jobs. I don't know that I'm convinced that the severance tax does that, but we want to have the dialogue. You're right to say there is political willingness to accept a shale gas tax in areas like southeastern Pennsylvania and central Pennsylvania, where people say, well, you know, those jobs aren't right here. I think I'll take the risk. Let's do that. But I think, again, it has to be in the broad context of both what do you want to do with the money, where's the money going to go, how will it be spent, and what does it do for job creation?
In about a minute, a little more than a minute we have left, I think you would agree the budgets didn't grow. The growth of the state budgets over court administration, through the Corbett administration's period, have been relatively low. There's some pent-up need to spend more, and maybe that's where.
Well,
and you're going to have
there
to
might
get
be some
revenue.
pent-up need. There's certainly pent-up demand. You know, I don't know if demand and need are the same thing, but there are. I think it's also true, and Charles Zogby said this last week, that there is no more appetite for cuts either. And so that becomes the issue. I mean, you know, we cut things. We looked for programs that weren't needed. We tried to reduce eligibility for programs. At a certain point, you know, this is it. Now you choose, are we going to be in this business at all, you know, education
But I think you would agree it's going to be a wild ride.
I am not making July travel plans.
There you go, a wild ride. All right, thanks for your insights. We appreciate them. All right, we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, you stay well.